I'm sorry. Did I hear Dr. Cole?
Sorry, go ahead. I kind of jumped in without raising the hand.
That's okay. Go ahead, Dr. Cole.
I just want to just say, Lila, thanks for sharing the information so that we can, stay aware of what's going on in the community.
Yes.
Lila, I still see your hand up. Was that the hand from the previous announcement? Okay.
I just lowered my hand and I'll put it in the chat real quick.
And I see Patrice's hands up.
Yeah, no big announcements from ORJ, but I did want to share, because this has been a recurring theme, not only from CAB, but then also from some of the other bodies that we support. We're getting a lot of requests regarding Measure X funded activities and what all is going on there and some of the proposals that are being funded and how can the various bodies either learn more about it or participate in it and things of that nature. So I just wanted to share for this group, because I know this group talked a bit about some of the potential resources that are also being funded through Measure X, that I'm working to connect with the Measure X CAB chair, as well as potentially reaching out to some of the corresponding agencies that are responsible for some of the efforts, not all of them, because it's a lot of them, y'all. But at the very least, just so we can, here in ORJ, we can have a better handle on all the information that's out there and how it's most relevant and related to you, so that as you're doing your planning for recommendations for other funded services that may actually be in the works, at least you are abreast to it and you are aware of it. So just wanted to share that with all of you, and that I'll be doing a little bit more research on that, and hopefully in time I can fill you guys in.
Thank you for that, Patrice. I'd also to welcome Jill Ray, and we are currently open for public comment on any item under the jurisdiction count of the Community Advisory Board, and not on the agenda, but also in public comment if there is any additional comments. And hearing none, we'll move on to item 3, which is the approval of the minutes from the February 18th, 2020 CAB and Policy and Budget Subcommittee meeting, and it's attachment 1. And we can take a moment to review that if necessary.
See Lila's hands up.
If we're ready, I'd like to make a motion to approve these minutes.
There's a motion on the floor for approval. Is there a second?
Yes, I would second that. I would like to second that motion.
Thank you, Dr. Cole.
You want to open it up for public comment?
Yes, the floor is open for public comment. Hearing none.
We'll move forward with roll call. Ozzy,
Aye.
Lila,
Aye.
and Dr. Cole.
Aye.
The motion passes unanimously. Thank you.
Thank you for that. The next item up, item number 4, is to review and update the work plan for 2022. And that is attachment 2, page 6 of the agenda. I'm sorry, page 8 of the agenda packet.
This is Lila, and I with a regular hand instead of a virtual hand. Is it possible to view this in view mode to see what we have as opposed to what we're taking out? That might help us, or that would help me in reviewing for any additional comments or questions.
Let me upload that to the chat. I'll go ahead and upload that.
Thank you so much.
Just give me a second here.
And Ozzy, while she's doing that, would you like me to kind of give context here and overview to help with you guys' discussion?
Yes, thank you so much, Patrice.
Okay. So at the last policy and budget meeting, we definitely did a lot of or made a lot of adjustments to you guys' work plan. And so based on that conversation, I made some edits here from what I heard and also some of the notes that you all sent back to me. So I can kind of walk through what these changes are, if that helps, and then open the floor for you guys to have further conversation or give feedback to myself about whether or not captured what it was that you all wanted changed or adjusted in the work plan. Does that sound like a good process? Okay. So, initially, so for your first goal, initially, you all plan to create advocacy around racial and gender equity in the local justice system. And what I heard, at least during our last conversation, that you really wanted to have a much more broader view around equity to also identify certain populations that are being served through AB 109 resources and to see where disparities may potentially lie there as well. I heard quite a bit around disability, folks with disabilities, mental health status, things of that nature, in addition to race and ethnicity or gender. So I did some language change here, and at least in your first key action step, we've changed conduct research focusing on evaluation. We took out Prop 47. So we adjusted this a bit to now read, you know what, and I might have, if it helps, Nicole, I have we could stop share and I could share and then put it in the simple markup. Would that help?
Yeah, it's in the chat right now. So if I was asking Monique to download that and share that, whatever is easiest.
Okay, let me do that really fast. Okay, can everyone see this? Let me. Okay, so this is a simple markup. So what you have in the agenda packet is the entire markup. So you see what's deleted and what's added. This is just kind of a cleaner view of that. So for the first line, is this large enough for everyone?
Could you make it a little bit bigger and then I'm good? Thank you, that's perfect.
Okay, great. So this first one here, I adjusted the language to read, review research and data findings on where inequities may exist in the criminal justice system for specific demographics such as race, ethnicity, gender identity, ability, mental health status, and its impact on AB 109 implementation. And then the expected outcome here would be to identify to what degree specific demographics such as race, ethnicity, age, gender identity, ability, and mental health status are being served through AB 109 services. So that's kind of like 1A. 1B would be identify gaps in Contra Costa County's criminal justice system to CAB to support policy statement or CAB stance on racial and gender issues. And here I remember hearing that you all wanted to partner with programs and services to identify new services and establish an equity focus, equity focus for specific populations in greatest need. And then lastly, this is still, you all still wanted to maintain a relationship, or at least begin developing a relationship or engagement rather with the racial justice oversight body. So this was adjusted to reassign a CAB member or CAB members to attend racial justice oversight body meetings regarding data reporting or developing data listening sessions to understand and support reducing racial and ethnic disparities in the criminal justice system. And then this would be the expected outcome would essentially be an assigned member will report out to CAB essentially on RJOB activities, at the general body meetings. And initially it was Ozzy here, so I put a question mark. I didn't want to leave that open for whomever you all as a committee or ultimately as a full body decide which CAB member or CAB members would be sort of tasked with this. So I'll stop here, at least for this first goal and the various action steps, and open it up or hear back from you all whether or not I captured what you all were thinking during our last meeting. So Lila, you have your hand up?
Yeah, that looks to me like you captured what we were saying at our last meeting. I have just been thinking, and I would love to add, folks experiencing homelessness for the first key action step. I know we were identifying, different statuses and identities, and I just, for consistency and, where my heart is and where things are at, I'd love to add in, maybe folks experiencing homelessness. I know that that's kind of long and it's making it longer, but wanted to see if folks would be in agreement with that.
Lila, if I can jump in as well, I think you highlight a good point here. Also, in adding with homelessness, I think that we need to somehow, and I know it gets a bit outside of the scope, but medical, making sure these individuals are properly included, whether they have medical insurance or not, becomes really challenging. So somehow to integrate that or incorporate that aspect or area within the scope of this field, I think is very important. So I'd just like to add that in with what you were just stating, Lila, to move forward on that first key action item.
Yeah, I imagine we could say mental and health status, maybe, I don't know, or mental health and health status.
I guess what I was hearing him saying was more in line with whether or not someone has health care coverage. So the uninsured.
Yes.
Is that what you were saying, Terrence?
Yes, Patrice,
Okay.
thanks.
Ozzy, do those two changes work for you? I know we're making it longer. Can we add those two things in?
Well, I I can appreciate the additions. And I'm kind of thinking as well, because one of the other issues that I'm passionate about would be some type of, well, and it can fall under mental health, it can fall under a lot of things, but substance abuse. And do we capture that? Are we capturing that here? Or what would that look like if we were to be all inclusive? Because then the list continues to expand. And that's just a thought that I'm thinking about. You know, I really appreciate the homelessness and also the uninsured. But there's also another group of part of the demographics that I'm also passionate about.
And
I
Ozzy,
think we should, oh, go ahead, Mr. Cole.
no, Ozzy, I totally concur. And if we can capture that kind of in the dual diagnosis or co-occurring type of situation, I think that we can capture that because that a lot of things fall up under that dual diagnose co-occurring, which is mental health, substance abuse, and also the uninsured. You know, so I think across the board, there's some things that could be included in that. I guess it just depends on how we state that in this item. Your thoughts on that, Patrice, or anyone else, how to formulate that within this action item that covers those aspects that falls up under these individuals participating in AB 109. How can we address that within this area?
Yeah, I think you can certainly add in individuals that are unhoused, those who are uninsured, and to some degree, some of that information is already being collected. In terms of those with the co-occurring diagnoses, I mean, you could assume that that is captured under mental health status. But if you're mostly wanting to know whether or not individuals who have a substance use disorder or issue and or behavioral health issue more broadly, if they are in fact being served, or as we're saying, an expected outcome, to what degree they're being served. I'm just not quite sure if the data is there on that. Where there is information is how many of those who are on AB 109 are accessing AODS services. But I can't say for certain there's a way for us at this juncture to quantify who within the reentry population that can access AB 109 services have an existing substance use disorder, and whether or not, irrespective of whether or not they are seeking treatment or receiving treatment. Does that make sense? I hope that makes sense.
Yeah. So Patricia, would it show if they're accessing those services in some type of data?
Yeah, there's aggregate information that's available that we could get from AODS that can tell us how many of those that are on AB 109 probation that are receiving treatment. Where it gets a little trickier is those who are will be considered having a history of justice system involvement. So that's just beyond AB 109 probation. Who of those folks are accessing AODS services? Maybe they do have that information. I'm just not certain at the moment, but it could be a tricky thing. I don't know if that is something that they capture when they're doing their intakes or assessments of folks who are calling into their access line, seeking some treatment.
Got it. Okay. Fair enough.
Oh, Jill raised her hand.
I was just gonna suggest, I think GPS, I think that might be one of the parameters that they were collecting data on their contacts within the system. That might be a good avenue. And then now, of course, with having 3 SUD counselors assigned to our detention system, I think there'll be a more robust collection of that data and more opportunity for contact with those individuals. Definitely, it's something that they do at assessment, but it's self-report. That's the other aspect of things that makes it challenging.
No, good point.
Thanks, Jill.
Now, in that case, you know, that's for sure. That's the jail population. So we can certainly likely get numbers there. But for anyone that has had a history of system involvement out in the community and whether or not they're accessing, like I said, I don't know if in the behavioral health clinics or in the residential treatment facilities that AODS oversees or administers. I'm not sure if they're capturing that.
Given this population and having just been in a Council on Homelessness meeting, and I think that there's limited follow-up, and you know, like ideally we would know in 1 year, 3 years, 5 years, and it's not something that we track at this point in time.
Yeah.
No, that's good to know.
But now homelessness, like you mentioned, H3, they're starting to do that more, at least through their the 211, their calls for core. They're able to, they do have like a checkbox, is my understanding, when they do intakes for those who have had, but it's self-report, of course.
I'm thinking about the point in time homelessness count too, and I wonder if there is a piece there on substance use. I'm not sure.
Yeah, I don't know.
Well, I just would like to, this possibly off the record, but from my experience, formerly incarcerated, the standard rule of thumb is primarily, I would say, from my own personal experience, probably over 55 to 65% of individuals who are incarcerated have some type of drug involvement. And that's definitely not stigmatized, it's true. And hopefully at some point we can get more data and it not having to be self-reported. There's a lot of different things that I'm hearing about, things that are going to be possibly, hopefully put in place to really address that from a governmental level. But it actually is one of my pet peeves because I understand the entire dynamics of that whole logistics of being incarcerated and having other things outside of mental, because I believe drug addiction is part of mental health, but it's also a reoccurring thing that if it's not addressed, it becomes a revolving door.
Thank you for that, Ozzy. Yes, I suggest that we put it all in this statement and, you know, it's there. And if we can review research and data findings on all of these, then we can, and we may be able to see overlaps. And, you know, if as we move through in time, we realize, okay, we can only really focus on less than all these things that we have, but, you know, just to put it there for now to see what we can advance on. Would folks agree to adding in then those 3 different points, homelessness, insurance status, and co-occurring, or yeah, however we wanted to state it, substance use, etc.
I concur, Lila, to add those as an addition.
And I would like to thank everyone for being able to articulate exactly what I'm trying to say, because I'm still developing my chops.
And I'm at the same time you guys are talking, I'm reviewing the Alcohol and Other Drugs Advisory Board monthly report that's coming up in the meeting next week. And the Crossroads program is what they're calling treatment in the jails. It is a grant funded program, so there will be data collected on that.
Oh, nice. Good
At
to
the
know.
same time, they're able to get the counselors in, and they're working with the DA, the Office of Reentry and Justice, Public Defender, West County Reentry Center, and Detention Health. They aren't able to do groups yet, but they're hoping to have that implemented sometime in the near future.
Thank you for that, Jill. So I'm assuming that we are moving on to our second action step.
Now, I'm also noticing, so this key action step 1A did not change. And I don't know if this is something that you guys want to consider adjusting language here, but the main change on this line is partnering with programs and services.
I think the question that just comes up for me on that point is, how are we going to do that? You know, we said we're going to partner with programs and services. Yeah, I'm just wondering, you know, how much of that really falls with programs and services, but we would still, you know, wanting to be putting that into policy. So yeah, I just talked myself out of it. I'm fine with what it says. Maybe we could just say that, you know, this committee is involved in, you know, supporting the vice chair in creating the policy statement.
Or does that verbiage need to change with partnering? Because that seems as if we're building some sense of capacity building and we're looking at policy and budget when we need to be looking at the equitable lens of what they're doing strategically as a program. So one or two things possibly need to occur. Either we change that and focus on the equitable side of it, or like you said, Lila, it gets very lean when we begin to talk about partnering with the programs, you know, because of what we're doing, the bandwidth of what we're doing may shift into something else with programs. So maybe we can look at that. That's just my supposition. I'm gonna put that on the table for consideration. To look at the equitable part of it, making sure that things are established within policy, within budget for the different programs versus it being partnering with the programs.
Yeah, and you know, I think that was the thought there was programs and services has a subcommittee of the CAB has a lot of overlap with you know, this work, and that's something that they're doing. And I guess I'm wondering if the ORG team, excuse me, ORG, I don't know what the org team, yeah. The ORJ team can speak to, you know, what it looks like for subcommittees to share information and to collaborate. Maybe the word is collaborate instead of partner, without, you know, messing up the Brown Act or, you know, all these rules that we're abiding by.
Sure. One thing you can do, and we see this happen in like our job or JJCC, which is maybe having a standing agenda item of a report from the respective committee. So like, let's say if you all wanted to present to programs and services, then maybe one of you from this committee would attend a programs and services committee meeting and just kind of share out, you know, some of the discussions that have been happening in policy and budget. And then vice versa, have someone from programs and services attend policy and budget. So that way those dialogues can happen that way. You could theoretically also have a joint programs and services and policy and budget meeting that would be publicly noticed that way. Now, however, if the number of members equate to half plus one of CAB, right? Then it will actually be a special CAB meeting, which is fine. But then you'll just notice it as policy and budget and programs and services having its joint meeting and discussing whatever items you guys want to discuss together. Did I get that right, Jill? She's the Brown Act expert. I just try to make it happen.
Great, Patrice.
Okay, thank you.
Terrence, you just came off of mute. You go ahead, Terrence, Dr. Cole.
It's okay. Now, I was just going to say, you know, what Patrice put out there, I think the possibilities are greater to have a concerted effort in trying to, you know, speak on a lot of the actions on this particular item or step. But once again, if the Brown Act is already incorporated into that. Is that my echo? Hold on.
I think so.
Is that better?
Much better.
Okay. So if the Brown Act is incorporated in that collaboration, I think that would be a good way to go. You know, if we can collaborate on those efforts together in reference to not taking it on as such like a program. So just something to think about. And Patrice, thanks for, you know, adding that to the dialogue.
I guess one other third option is that it could be a general meeting discussion as well. That would be a third option.
I like it, Terrence. It sounds like partner was maybe not the best word here. Do we want to change this to collaborate or leave it as is?
I think collaborate is good. That way, you know, we're not confused at what we're doing with the verbiage, you know, so as a better term, I think so. Ozzy, your thoughts?
I concur with that as far as collaborating would be a better choice of verbiage. Patrice, were you saying something?
No.
Oh. So we're I'm sorry, Dr. Cole, go ahead.
Yeah, well, I was just gonna state what were you gonna make those changes, Ozzy, or does Nicole make those changes?
Yeah, we'll make those changes.
Okay. Thanks. Okay.
So we're taking notes as you guys are making suggestions for language change or any updates here.
Thank you.
So my question is, I see that, will there be a responsible person for this particular item?
So, and that's a good question, Ozzy, because for both the column on timeline for all of these, as well as the responsible column, those have not been adjusted at all. So, that might be something that this body wants to talk about as well. Yeah, and Jill has her hand up too.
Yeah, I was just going to say, this is just such a huge issue in our county right now. Last year the Board of Supervisors declared racial equity a public health emergency. And, we have the development of the Office of Racial Equity and Social Justice. So I think, all of this ties in together with that. There's a great lot of things that we're leaning on that development of that office, which is taking far longer than I think any one of us anticipated. It may be something, a longer term goal, because this work is not likely going to sit in the ORJ. It's going to be sitting, that RJOB work and all of this is going to be sitting in that Office of Racial Equity and Social Justice for our county, which will be working across all aspects of our county to collaborate all the many different efforts that we're already doing to ensure that we're sort of all on the same page with the work, because it crosses over so many different lines.
Thank you for that. And Lila, I see your hand up.
Thank you. And were these original timelines, were these geared towards giving us, time to present to the CCP and writings, or I'm just wondering what June and August, was connected to for number 2 key action steps?
Yeah, without really knowing the back history on how the work plan was developed for the previous policy and budget subcommittee, but I'm guessing this is in preparation for your policy brief development that usually takes place during this time. And then you usually submit your policy brief to CCP for consideration during their budget workshop meeting, which usually happens in November. So it could have been aligned to that. Now, mind you, also last year, CCP did agendize each of your recommendations of the previous year as well. So that was a new thing. So I think your timeline on these items are somewhat open, and given what Jill just shared, that some of this stuff is going to be just, ongoing. So if you're not able to accomplish, in terms of having some sort of product or what have you this year, that's okay. That might be item of work that you want to continue on even in future years, because that work will keep going. So you have some flexibility to kind of think through what timeline you want to have on here.
Got it. I would like to, put my name down for identify gaps in Cocoa County criminal justice system, primarily around the overlap or partnership, collaboration with programs and services subcommittee. So yeah, we can put down Lila Blanchard if Ozzy and Terrence are good with that.
Thank you, Lila. Yes, definitely good with that. Dr. Cole?
No, I concur, and I do just want to mention Ozzy, so that so that, you know, we kind of staying on task. And can we come back to the timeline, work date and responsibilities, make the adjustments to the key action steps, and then come back to the timeline? Because what Jill just stated changes a whole lot in what we need to do in regards to a lot of things that's happening or what's coming down in the future. So if we can make adjustments to the key actions, look at the timelines, and go through the work date and responsibilities in that order, if that's okay with everybody, my recommendation. and so that we can kind of stay on task, because I'm kind of, I got questions about the timeline as well, like Lila, you know, in sticking with, are these still relevant, you know, and where do we go from here? Can it be 3 months? Can it be in the end date? And the end goal is November. So I want to kind of, if we could, stay organized on this piece and kind of roll it out as we go, so we can know kind of where we are. And as things come up, we can stay focused on those items. If that helps. Thanks, Ozzy.
Thank you, Dr. Cole. I concur with that. Focusing on the key action items, and definitely the timeline needs some adjustments, because we're already in the month of March, and the next item is supposed to have been collaborated and brought to fruition between, the timeline was January and March. And when we get there, I'll have some other things to add. But thank you, Dr. Cole, for bringing that to the forefront.
Lila, is your hand up, or is that from the previous? Okay, thank you.
And Jill just put in the chat that the next report on the Office of Racial Equity and Social Justice Development is going to come before the Board of Supervisors in June. So that's good to know in terms of timelines there.
Thank you, Jill.
I want to come back to that question, Jill, when we get back to the timeline. Just as a standby. Thanks, Ozzy.
Okay, I guess we'll move on to the third key action step. And that's to assign a CAB member or members to attend racial justice oversight body meetings regarding data reporting or developing data listening sessions to understand and support reducing racial and ethnic disparities in the criminal justice system. And as we see, my name is in the box for responsible individual. And my, I'm going to just have to really be honest. I haven't been into any of the meetings thus far because there's a conflict in my schedule, but definitely after May, I will be in attendance. But I think maybe we could consider maybe a second person, if that would be something that the committee would be in agreement with, or if someone would like to volunteer. If not, I won't be able to be active until after May.
Patrice or Jill, are these virtual meetings or are they physical meetings, brick and mortar?
These are physical, excuse me, these are, for now, they're virtual meetings. Let's hope they stay that way. And the RJOB full body meetings happen on a quarterly basis. So I believe the next scheduled RJOB full body meeting is going to be May, correct me, Nicole, May 5th? Did I get that right? May 5th?
I have May,
And
oh no, that's diversion, sorry.
Yeah, May 5th is the quarterly meeting.
yeah, so that'll be the next quarterly meeting. And then there are subcommittees, which are the diversion subcommittee, data subcommittee, and then data diversion, and community engagement and funding subcommittee. Each of those subcommittees meet on a monthly basis. As a matter of fact, we're posting agendas now for data. The next data subcommittee meeting is next Wednesday.
The data is the fourth Thursday of the month on a recurring basis. And diversion's the third Thursday, and then the community engagement funding's the second Thursday of the month.
Okay.
And the
And-
meeting that, I'm sorry,
Go ahead, Ozzy. Go ahead, Ozzy.
the meeting that I was specifically interested in was the data subcommittee that actually gathers the data, and the meetings that I have attended, they were gathering the listening sessions and doing other things that was very informative and something that I would definitely want to be a part of moving forward.
And they meet 3 p.m. to 5 p.m. right now.
Nicole, is it data or is it community outreach that's doing the public meetings?
So the community data forums are, I guess the ownership is on the community engagement and funding subcommittee, but it's a partnership with the data subcommittee. Because some of the data that they're sharing is coming out of the data subcommittee. I
Right.
guess it just depends on what this group is interested in. If it's
Right.
both, then
RGOB data collects the data and reviews it. Then the community engagement and funding is grabbing that data and doing the community forums.
correct. Mhm.
So I will say the next data subcommittee meeting, there will be an agenda item on a debrief of the last data listening session. So that meeting is next, what is it again, Nicole?
Next Thursday, the 24th, from 3 to 5.
Yeah.
But I also can post the YouTube video from the actual the listening session that they did have, that you can look at your own time if anyone's interested, from the February 16th data community forum that they had, that they're debriefing on. It might be helpful to see that, so that when you join next Thursday, you have some context.
I will be able to go to next Thursday's meeting. The data subcommittee.
And I would ask the question, Patrice, is this one of the items from prior action items and goals?
Yeah, this was last year's. Now the language changed a little bit. Let me see, what was the last?
The partnership with our job was not part of last year's. They made a change in November to talk about wanting to do this year, but the actual initiative itself did not come about until about November of last year.
Okay.
Got it. Because I think you bring up a good point here, Nicole, with identifying what data we're actually looking for or trying to gather in regards to policy and budget. And hold on, there's my, turn it down just a bit, volume. So with, just looking at reducing racial and ethnic disparities in criminal justice, just as Jill put it, this is an ongoing type of item. All of it is, all these action items are, and they're going to be housed, I'm assuming, within the scope of Office of Equity and Social Justice. So beginning to look at that in kind of narrowing the scope, I think we take steps at a time, depending on that data that's being selected, and beginning to identify what that goal is for CAB. It may not be both, it may be one, or it may be both, depending on what we have to reach for. Just like you said, Ozzy, beginning in May, beginning to look at the data and what's being captured. What are we identifying? What's the goal on that? And that's why I asked the question, Patrice, in the past, and kind of the iterations now. Do they need to change more or stay the same? What are we looking at right now in reference to moving forward as this topic is going to be ongoing, as Jill put it, and put it into work to date, it may change. It may change daily or weekly or frequently, so we just don't know. So how do we narrow the scope to this just a bit, keep it the same, but narrow it down just a bit? Does that make sense to anyone?
Yeah, but I think this is a good first step, and thank you, Nicole, for giving us that clarity on the previous year's timeline. So this was updated in policy and budget's work plan, but toward the end of last year. So this didn't really get kicked up, So I think you're okay with this one. This is just, for the most part, having a CAB member attend some of these meetings just to hear what's going on, and then from there, sharing out with policy and budget, and you can make a determination from there what further involvement would you as a subcommittee and or expect of CAB, from there further. So, but I think this is a okay first step. I don't think you would be, in other words, it's not really onerous, for this body. It's just a matter of who you would want to attend those meetings, whether it's from this subcommittee or from any of the other members of CAB.
Got it. So we're just gathering information to have a sitting place to maybe discuss, build a narrative around these different topics that's being calibrated within or aggregated within this data. Is that what I'm hearing, Patrice? But we're not.
At least the way that I'm seeing it is, and certainly Ozzy or Lila, you guys can correct me if I'm wrong. The way that I'm seeing this is almost no different from the other CAB assignments to other various meetings, like attending PPC meetings or board supervisor meetings, or the Reentry Success Center Steering Committee and some of their meetings. So yeah, just to gather more information. I think the reason why this is so clearly highlighted than in your work plan is because this body has a specific interest in racial justice and racial equity issues, and want to bring that more to the forefront of its work. So, and as I mentioned, I think this is the initial first step, since the racial justice oversight body is a body that is, well, it's really the only body that exists in the county right now until the Office of Racial Equity and Social Justice opens. It's the only kind of space in the county where these kind of topics are being discussed.
No, I agree. Oh, go ahead, Lila.
All right, I saw Ozzy jump in there too. Go ahead, Dr. Cole.
You sure, Ozzy? Lila? Oh, I thought you had.
Well, I did have something I wanted to interject, and it was primarily the reason why I started going and wanting to go to the RJOB meetings is because, going back to our action item number 1, the demographics and the data that was being collected wasn't inclusive of some of the demographics that I specifically wanted to know. For example, going back to not only racial and ethnic, gender identity, but ability, mental health status, and other issues, other things that can be collected. That's what I'm interested in. And how would that be articulated to bring to another committee that we want to see more data and highlighting the specifics that we want to see? So I'll ask someone to interpret that for me.
No, I'm with you, Ozzy. I think that first and foremost, we need to be data driven. That gives us, because the numbers don't lie, depending on what is being identified within the data, correct? So I think that being led by the data is going to give us some real substantial outcomes and results that we're looking for, depending on, once again, the action items that's selected. So this it's a very important area, as Patrice has put. And we need to continue to look at the data, but we need to select like points in reference to what we're trying to identify, because the data can get very expendable. And what I mean by that, it could go for miles in days that we could look at, but we need to be specific on what that looks like. And I think we captured some things here. I just want to make sure that we're all on the same are we consistent, or it has a sense of what we're looking at and how to move forward with the data that we're collecting.
Thank you for that, Dr. Cole.
Mhm.
So I guess we're at the point of addressing the need for CAB members to attend the Racial Justice Oversight Body meetings. And as I said, I will be available after the month of May. Although on the 24th of next Thursday, I will be available to go to the subcommittee, the data subcommittee for our.
And I just forward you that invite,
Okay,
Ozzy.
thank you. I got it.
Mhm.
Thank you.
You're welcome.
And if someone else would like to participate, that there's more, the more the merrier.
Ozzy, you can put me down for the first one as a responsibility. And we can circle back on work to date, since the dates are from August to December. We can circle back to that. But yeah, definitely put me down for the first action item for responsibility.
Thank you, Dr. Cole.
Mhm.
I just wanted to make sure that I was tracking. Dr. Cole, did you just sign up for the review, research, and data findings on where inequities may exist in the criminal justice system, et cetera, or assign a CAB member to attend racial justice oversight body meetings for the first meeting?
Just assigning the responsibility of just the review and research.
Okay, review and research. Okay, so the first key action steps, you'd like your name up there.
Yes.
Got it. Thank you so much.
Mhm.
And were the timelines for all the goal one key action steps ongoing? That's the sense that I got based on where we're at in the county of opening up the Office of Racial Equity and Social Justice. Was that my understanding correct?
Timeline being ongoing.
For all 3 action steps in goal number 1?
I'd like to leave the timeline there and say ongoing. I mean, maybe those dates will be helpful for us as we manage the work. Maybe they won't.
I agree, because with the dates we have, it gives us an idea of where, we could begin to end, but ongoing is probably where we're going to land, right?
Okay.
Because of the ongoing, because of what has been related today.
Okay. The third one is already passed, so I just want to make sure. Did we want to put April through December on there or something?
I think we can just write /ongoing next
Okay.
to each of these timelines.
I agree. Thank you, Lila. So are we moving into goal number 2 at this point?
You can, Madam Chair, if that's what you would like.
Well, let's move on. We still have another 30 minutes on the clock. So
Okay. So for goal 2, we have pretty straightforward, developing your budget for, oh, that actually needed to change. I'm sorry, I didn't. This should say 23-24 CAB budget, because you've already done your 22-23. So I'll make that correction. Let's see. I'm just trying to make sure. Okay. And so some of the changes here, based on the conversation I heard, was that we really wanted to get a better sense of a CBO and community needs that would be served through AB 109 funding for community programs. This came in, even though it says survey, please don't, I couldn't find a better word. I probably should have looked in the source somewhere. So this doesn't necessarily mean an actual survey, because you all did not talk about that, but just generally speaking, what gathering information, maybe I should have put it that way, gathering information on what the CBO and community needs are that can be served through AB 109 funding for community programs. And then from that, you develop an informed budget based on those CBO needs and community input. And this is something that you typically do anyway, when you're inviting CBOs to give their feedback on what challenges did they face implementing their programs, funding wise, where would they like to see increases in funding, things of that nature. So this is essentially a continuation of what you typically do anyway as you're putting your budget requests together. The next one, now these are the newest items, and the main thing that was sort of, I guess we kind of put this on the parking lot, if you will, to discuss this meeting, which was what does this committee want to do in terms of ongoing monitoring of AB 109 funding. I put it here as the expected outcome. Just about every quarter, the CCP reviews some financial reporting that's happening within that quarter, within the past quarter. So that's an opportunity for this committee and or the full CAB to review that financial reporting, to see if funds are in fact being used as was budgeted or was intended, things of that nature. And then that lends you to the expected outcome of the ongoing monitoring of the use of AB 109 funds. The next one was, I'm surprised to hear how quiet Mr. Carpenter is, but he might pipe up on this one. There was definitely great emphasis on need to propose increased funding for mental health services. So I just at least identified it here as an action step. There was no discussion yet from you all in terms of expected outcomes. So those were the changes there. Again, I did not make any adjustments to timeline, and I certainly didn't make any adjustments to who will be responsible, because those were things that weren't discussed during the last meeting.
thank you, Patrice. The floor is
Ozzy, this is Crawford. I just had one comment because this is my listening day, and thank you. I really appreciate the subcommittee adding that particular item, to increase funding for mental health services, etc. So most appreciated. I'll leave it at that and let you move on.
Thank you, Crawford.
So looking at the first key action step, I would suggest maybe just changing that language a little bit to say general survey and review of the survey results. So the Programs and Services Subcommittee does do a survey, and I'm assuming that it gets reviewed in this subcommittee because a lot of the suggestions, were included. And so I would, I'm happy with leaving it as is, or we could say, general survey and review of Programs and Services Subcommittee survey. Those would be, two different ways that we could get information to inform our recommendations.
Thank you for that input, Lila.
Okay, how about we say general survey, and that's just going to cover everything. General survey of CBO and community needs.
I like the review, Lila, because it's kind of all encompassing. You're collecting the data, you're gathering it, and we're going to review it strenuously.
And I didn't have any more questions or comments on the second one, review quarterly financial reporting. I'm excited to learn about that and engage in that. I see that it doesn't have a timeline, but we'll be adding in ongoing. So if there aren't any particular dates that we need to be aware of for that one, I am, I'm good with that one as it stands.
I concur, Lila. Unless now on the responsibility side, is this area for all members, or do we select individual members to be responsible for this sector?
I would just highlight how we kind of tackled this last year, was that ORJ tried to assist getting these quarterly reports to the actual subcommittee meeting itself as an agenda item, so you guys can review. I guess you could say it was kind of a standing agenda item because we have a schedule that CCP puts out there. It's a quarterly, that they meet quarterly. And so we tried to time that where we bring that report into the actual subcommittee meeting itself. So just wanted to add that. So if you decided to continue that, that would be kind of handled inside the meeting itself.
Okay, Ozzy, back to you.
Is there any further discussion on this item? If not, let's move on to a timeline, possibly. Or are we going to leave it ongoing?
I like ongoing for these, and I think to the point Nicole just made, all members will be responsible because we'll be receiving the second key action step under goal 2.
I concur, Ozzy.
Okay, thank you. Moving on to key action step number 2, review quarterly financial reporting presented during CCP meetings to ensure funds are being expended as intended. And that's an ongoing monitoring. Do we have anyone that's going to be responsible for that?
So that was the point that I was just speaking to for ongoing for timeline and all members responsible for that one, if that
Okay.
works for folks.
Very good. So that moves us down to number 3, key action step, purpose, propose increasing funding for mental health services. Will this also be ongoing? Or will we have a specific timeline?
So this
If you're-
one, you might want to think through the strategy around this. You know, as you all may have recalled last year, CAB deliberated on whether or not to have a percentage of the AB 109 funding for community programs be dedicated to mental health services. And at that point, it was determined that that's probably not the best way to go about it. So if you are intending to propose an increase of AB 109 funding for mental health services, I think the proposal will need to be made around this November timeline, because that's where the CCP will be discussing. That's the meeting where it will be a budget workshop. So they'll be looking at all budget requests from all agencies, right? But leading up to that, you all can discuss what's your strategy, what exactly do you want to propose in terms of funding, a funding amount. Are there folks that you need to speak with from forensics and mental health, or the mental health services that are currently being funded through AB 109? Is there some research you want to do on, let's say, for example, Measure X, that's funding some mental health services as well? So all of those things combined will kind of help you determine what your actual proposal will be. And then the proposal will need to be made by your November, by the CCP's budget workshop in November.
I have a question for Crawford. So hopefully you don't mind being brought back into this, Crawford, because I know this came from you last meeting, you know, with a lot of passion and emphasis and decision. Can you say a little bit more about the problem that you're looking to solve with increased funding for mental health services? I'm trying to wrap my mind around, you know, the different funding that's out there and the different types of program and what it is that you want to see changed with, you know, a focus on funding in that area.
Well, maybe it wasn't so much to say change, more than to identify the area, which I think the group has done, step number 1. And step number 2, I was concerned and wanted to look into our CBOs and what commitment they were making. Some of them are already engaged from what was shared with me previously in some type of mental health activities. And then my, you know, kind of thought process, well, what about the ones that aren't? Would it be appropriate for each of them, just so that we understand the importance of mental health, that each of our CBOs take a look at their particular portfolio and then come back to us and say, well, doggone it, maybe we can add a mental health component. And I come back from the outreach and community engagement interview with a person that had been previously incarcerated. And his statement was, if your mind isn't right, your head isn't right, the job doesn't really mean that much and housing doesn't mean that much. And that really got my attention. And that's where I thought that maybe we should take a look at each of the CBOs and see if it's possible. So I'll leave it at that. Thank you.
You know, that, oh, Patrice, sorry, go ahead. I can go next.
I was just going to give a little bit more context too, in terms of the mental health services that are provided through AB 109. So there is funding that's made available for mental health services through our forensics mental health unit, if you will, for all of those that are on AB 109 probation. Well, probation, generally speaking, also just our general supervision population of folks. Those who are not on any supervision in the county, they would then have to access mental health services, essentially similar to any member of the public. So they would have to call an access line to get connected to resources. I will say though that Measure X has certainly provided a lot more funding to expand crisis response for those who are in interventions, for those who are experiencing a mental health crises, and that's to serve the general public. There's also the forensics mental health also has, I'm forgetting the name of it, mobile health crisis response. No, mobile health response. I'm going to butcher the name, forgive me. But anyway, it's a mobile health, mental health support that helps to de-escalate before it becomes a crisis, right? So there's community members that go out, and that's becoming more and more of the model that the county wants to follow, is how do we address mental health issues and concerns in the community without needing to involve law enforcement. So I will say that those resources are becoming, because now funding is made available, are becoming more available, right, to the community. But I do think there is something to say about whether or not, or how do we have the reentry population be a prioritized population in accessing those resources, or what can be done systemically to ensure that there is a pathway to those new resources, and existing as well. So I just wanted to kind of add that to your deliberation on how to formulate your strategy around this.
Thanks for bringing that up, Patrice, because it's kind of a good oversight for mental health and what's to become. I think more so of proposing we should review how mental health services are increasing their funding for programs, if that's more so of a sense of identifying mental health, because there's a definite need, Crawford, like you bring up, definitely needed as it crosses over with dual diagnosis, substance abuse, not even added the uninsured. So we have to start somewhere with the mental health. But I think more so proposing an increased funding, we should be reviewing what you just stated, Patrice, as we move forward, because things are to come through the services of mental health. It sounds as if they're working on preventive services in the process. So there's a lot of, like you said, there's a lot of funding that's going towards mental health. How do we structure that in a way where we can begin to review and make sure these sources are, or these funds are in services are being appropriated equitably within the community. So just as something to put on the table for us to think about. Not that that's the key action item, but to review, I think more so in my supposition, would lead us down the path of looking at the funding increase, how preventive services are working for mental health, how social justice is being applied to mental health, law enforcement, and also corrections, to look at those different aspects of how the services are working through mental health. I just put that on the table for thoughts.
Thank you, Dr. Cole. That is helping me frame my thinking around this as well. As someone who works for a nonprofit, I like to bring in the county departments as well. Whenever we talk about the AB 109 system, sometimes there is, extra attention that's paid, for the nonprofits. Speaking to the AB 109, system collective, I hear that Crawford is talking about mental health being part of like a holistic delivery of services and, an essential part of delivery of services. And I, agree, it's got to be in there in different ways. And I think the question for me is just like, what is needed for folks to feel like they can access mental health services that are culturally appropriate, that, that they're not turned off from, that are accessible, that are ready for them, when they're ready to access them. So, I think that there could be more conversation around, how we would want to lift up mental health services in a policy or, in the budget as well. So I like it being there. And I agree with Dr. Terrence that, that there needs to be, a unified, clarified recommendation around what type of mental health services we want to see increased, or how to support the system as a whole. Because I think sometimes there's also like the services are there, but folks aren't accessing them, or the services are, in a way that's not accessible or not attractive or open to them.
Thank you, Lila. So with that being said, our next position would probably be to create a proposal around the mental health issue? Or is that something we would like to table to the next meeting to have some thought around?
So if I can quickly recap what I heard, I'm hearing that in this area here, maybe before we get to proposing increased funding, we should review, what do I have? Review mental health services. I'll work with the language, but it's essentially want to review some information prior to proposing increase of funding, and then maybe the expected outcome is a proposed mental health strategy, or propose some strategy that would take into account what CBOs and county agencies can do in terms of improving accessibility, culturally competent, mental health services and resources. And that may have some funding implications. So that would be your policy brief and or budget recommendations.
I totally concur, Patrice, because we don't want to speculate. We want to review, look at what's increasing in mental health services. We want to, we don't want to say the work is not being done because people are working hard. Sometimes people fall through the cracks because they don't know the services are there. So we want to be clear what that review looks like and also be able to track that somehow because once again, the data are numbers. It has nothing to do with any type of narrative, but it shows us numbers in which we could actually be consistent with if we begin to review and see how these funds are utilized in the community. So thanks for that, Patrice. Yes, that works for me. Absolutely.
I would just like to add into this. I just found out last week that with the changes in CalAIM, which is the Medi-Cal coverage, there is a, let me read this. This is from our health plan administrator, that going forward, the managed care plans will be responsible for when justice-involved individuals are reentering society to ensure screenings and referrals and work with CBOs that support those members. There's more information to come. So that might be something interesting for you all to look at and kind of be mindful of to ensure that that's rolling out as intended in our county. That's a big move forward. It's really just making sure those people who are leaving are connected to services rather than what we all know is often happens is they fall off the cliff because they've lost their coverage. So the intent of this is to work on the inside to ensure that when they come on the outside, they're connected to coverage.
Thanks for that, Jill. That's very pertinent information because once again, that falls into the increase for mental health, substance abuse.
It's both behavioral health and medical care. So it's both.
Yeah. Absolutely. Thanks for that, Jill.
You said, and Jill, did you say that was announced through our county health plan, or?
I'm sending it to you right now, Patrice, so you can see what.
Okay. Cool.
Yeah.
Thank you.
It was the contract. It's the JCC, the Health Plan Joint Conference Committee. Supervisor Anderson sits on that, and Sharon Mackey announced it, and I asked for follow-up information because it was a very quick report. So I will send that to you.
Okay, awesome. Thank you.
Thank you for sharing that, Jill.
This is why I need to still Zoom in all my meetings so I can be in more meetings.
So with that being said, before the meeting ends, I have a question. The next, and correct me if I'm wrong, the next thing that we need to do is to review the information. And who would be the responsible individual or individuals that would be tasked with that or volunteered?
Ozzy, I could do it, but I would think that it would be more beneficial for all of us because of so many different vehicles that this funding is coming through now, along with CalAIM. There may be other entities that's getting involved now. So we want to make sure that, we get enough information that we can gather and in reference to reviewing what's on the horizon for mental health, which is very important that we plug this item into the action item as Crawford mentioned, moving forward, because we know that's going to be another ongoing item that may even fall up on the Office of Equity and Social Justice. So, let's just kind of keep that in mind. So I'll definitely be a startup person to do that, or we can do all, all committee.
For
Can
that,
we
Dr.
put somebody else? Oh, go ahead, Ozzy.
No, Lila, I was just thanking Dr. Cole. You're on, Lila. Thank you.
Can we put Dr. Cole and all members? It's nice to have someone who's like, yeah, especially keyed in, and then I will definitely participate in ways that I can for that as well.
Thank you, Lila, for that.
Yeah, I think it's safe to assume that even though we'll identify certain members as responsible, it's more or less like you're the lead, but that all members would have some input and some involvement in each of those action steps.
Thank you, Patrice. And with that being said, it is 12:03. And we're adjourning the meeting until the next subcommittee meeting, which will be April the 15th at 10:30 a.m.
Thank you, Ozzy.
Thanks, Ozzy. Super job. Thanks, everybody.
Thank
Until
you.
next time.
Bye.
Have a great weekend.
Bye-bye.